Dr. John Funk, sworn in for the state, 195th to testify. I am professor of pathology and bacteriologist. I was shown by Dr. Harris sections from the vaginal wall of Mary Phagan, sections taken near the skin surface. I didn't see sections from the stomach or the contents. These sections showed that the epithelium wall was torn off at points immediately beneath that covering in the tissues below, and there was infiltrated pressure of blood. They were, you might say, engorged, and the white blood cells in those blood vessels were more numerous than you will find in a normal blood vessel. The blood vessels at some distance from the torn point were not so engorged to the same extent as those blood vessels immediately in the vicinity of the hemorrhage. Those blood vessels were larger than they should be under normal circumstances, as compared with the blood vessels in the vicinity of the tear. You couldn't tell about any discoloration, but there was blood there. It is reasonable to suppose that there was swelling there because of the infiltrated pressure of the blood in the tissues. Those conditions must have been produced prior to death, because the blood could not invade the tissues after death. If a young lady between 13 and 14 years old eats at 11:30 a.m. a normal meal of bread and cabbage on a Saturday, and at 3 a.m. Sunday morning she is found with a cord around her neck, the skin indented, the nails and flesh cyanotic, the tongue out and swollen, blue nails, everything indicating that she had been strangled to death, that rigor mortis had set in, and according to the best authorities had probably progressed from 16 to 20 hours, and she was laying face down when found, and gravity had forced the blood into that part of the body next to the ground, that it had discolored her features, that immediately thereafter, between 10 and 2 o'clock, she was embalmed with a fluid containing usual amount of formaldehyde, this being injected into the veins in the large cavities. She is interred thereafter, and in about a week or 10 days she is disinterred, and you find in her stomach cabbage like that, states Exhibit G, and you find granules of starch undigested, and those starch granules are developed by the usual color tests, and you also find in that stomach 32 degrees of combined hydrochloric acid, the pyloris closed, and the duodenum, and 6 feet of the small intestines empty, no free hydrochloric acid being present at all, nor dextrin, or erythrodextrin being found in any degree, and the uterus was somewhat enlarged, and the walls of the vagina show dilation and swelling, I would say that under those conditions that the epithelium was torn off before death, because of the changes in the blood vessels and tissues below the epithelium covering, and because of the presence of blood. I would not express an opinion as to how long cabbage had been in the stomach, from the appearance of the cabbage itself, taking into consideration the combined hydrochloric acid of 32 degrees, the emptiness of the small intestine, the presence of starch granules, and the absence of free hydrochloric acid. One can't say positively, but it is reasonable to assume that the digestion had progressed probably an hour, maybe a little more, maybe a little less. Cross-examination. Dr. Dorsey asked me to examine the sections of the vaginal wall last Saturday. The sections I examined were about 1/4 of an inch wide and 3/4 of an inch long. It was about 9/25,000ths of an inch thick, that is, much thinner than tissue paper. I examined 30 or 40 little strips. That was after this trial began. I was not present at the autopsy. As soon as a tissue receives an injury, it reacts in a very short time. The reaction shows up in the changes of the blood vessels. You can tell by the appearance of the blood vessels whether the injury was before death or not, and you can give an approximate idea as to the length of time before death. I do not know from what body the sections were taken. I know that it was from a human vagina. The state closes. Evidence for defendant in rebuttal.